If you ask patients today or even providers today about interoperability, the reality is that they don't care so much about interoperability as they care about having the right data at the right time.
The biggest barrier that CommonWell is helping break down, in my opinion, is the ability to identify patients across different health IT vendors. It's one of the most significant problems that our industry has faced as a true barrier to interoperability. And CommonWell is having already a very strong impact on solving that issue.
Our participation in CommonWell has allowed us to collaborate with other members in a non-competitive way, which is very refreshing. We've taken that team approach to our data, and it's allowed us to explore how our EHR data could work well and be received by other entities, such as standalone laboratories and even retail pharmacies.
I think a good example is the banking industry, something that today we all take for granted, which is just taking money out of the ATM, is something that was a hassle before. And that industry was very dysfunctional until all the banks came and decided to work together.
The biggest barrier we have to data exchange today is competition between organizations. So when we can provide patients meaningful choice in how their data is exchanged, that changes the game.
One of the things that we can do is help them exchange information and do so at lower cost. So CommonWell kind of represents a new business model that we can bring scale to interoperability and drive down that cost over time. I think we did have an aha moment when we were enrolling a patient and we asked them if they wanted to enroll and participate in a network where the hospital sent information to their physician. They looked at us kind of quizzically and they said, yes, of course, but aren't you doing that already? It kind of made us understand that patient expectations are going up and that we can do a lot more.
They really appreciate our matching process, and they really appreciate the fact that we get the data through our query retrieve process.
The CommonWell technology enables your health records to travel from provider to provider, realizing the original dream of electronic health records.
It's important to understand how pharmacy has become much more integrated into the care of the patient. Our role is just not to dispense prescriptions, but to improve that patient healthcare outcome. So we're excited and look forward to working with the home health providers, the labs, the physicians, and all of the other providers that are eager to join CommonWell.
I think it's very exciting to see all these companies that are competitors working together closely. Also, we just want to be part of the solution, right? I think the healthcare industry is very fragmented and there's a lot of waste, and fixing the patient data exchange problem is going to be something that's going to be significant.
The collective member experience is necessary to solve the patient identity crisis. While many solutions exist today that can identify patients within unique areas, being able to work with other vendors across a given community has enabled us to solve this for multiple organizations and not just our own. The inherent nature of CommonWell is that we need other members to participate to help solve these issues.
CommonWell Health Alliance, we're in.
We're in.
We're in.
We're in.
We're in.
We're in.
CommonWell Health Alliance, we're in.